My name is Dr. Ampadu. I'm a heart failure cardiologist at Prisma Health, University of South Carolina. And I'm going to give you a brief overview of hereditary ATTR amyloidosis. So amyloidosis is a group of diseases characterized by a protein that normally functions in the body, but due to different influences, it misfolds and it leads to insoluble amyloid fibrils. There's actually over 30 different proteins that have been described to lead to amyloidosis. But when we talk about the deposition in many different tissues, there's only a few that can lead to deposition of the heart. And when we talk about heart deposition, that's cardiac amyloidosis. And of the few, these two make up greater than 95% of cardiac amyloidosis. So first one being light chain amyloidosis. So the L stands for light chain. Plasma cells, they make antibodies. On antibodies, you have light chains. You get buildup of these light chains in excess. They misfold, and then they lead to amyloid deposits, and they deposit into the tissues. And we said this can deposit in the heart tissue. The next one is transthyretin amyloidosis. This is a protein that is mostly made in the liver, but it transports thyroxine and retinol, which is vitamin A. And of transthyretin amyloidosis, there are also two different forms. So we have an inherited form, which is hereditary transthyretin amyloidosis, also hATTR. And then we have the acquired form, which is wild-type transthyretin amyloidosis. So we want to kind of take a step back and talk about the pathophysiology of transthyretin amyloidosis. So how does this process happen? So as we said, majority of transthyretin is made in the liver, actually greater than 95%. So transthyretin is seen here as a tetramer. So you have 4 subunits together. And the pathology happens when this subunit dissociates into single subunits, which we call monomers. This dissociation happens because of a mutation. The mutation can be inherited, so that is that hereditary form that we mentioned, or it can be acquired as you age, and that's the wild type version. So the tetramer, again, dissociates into monomers. It misfolds. You get a buildup of different monomers, and this leads to amyloid fibrils. And these amyloid fibrils can deposit into many different tissues. So we said cardiac amyloidosis is when it deposits in the heart. So we see heart failure, we see cardiac arrhythmias, have shortness of breath, leg swelling, valvular disease, a lot of different heart manifestations. And it can also deposit in the peripheral nervous system. You can have numbness, tingling in the hands and feet, which can lead to weakness in the hands and feet, inability to walk. We can see deposits in the carpal tunnel system, where you see carpal tunnel disease. We can deposit in the GI tract, where you have diarrhea, constipation, weight loss. But these amyloid fibrils can deposit in many different tissues. So specifically with hereditary transthyretin amyloidosis, we said this is the inherited version, and it's inherited in an autosomal dominant fashion. So as a reminder, what that means is if somebody has the mutation, they have a 50% chance on passing it to one of their offsprings. And these mutations can be substitution or deletion mutations in the genome. And there's over 150 different mutations or variants that have been identified. And again, these mutations can lead to disease, which the disease can have those symptoms that we mentioned before. You can have a sensory motor polyneuropathy, that's the numbness, tingling in the hands and feet, leading to inability to walk, etc. Can have autonomic dysfunction. This is how the body processes involuntary functioning. So blood pressure, heart rate, these things can be out of whack. And then we talked about gastrointestinal, weight loss, diarrhea, constipation, and then cardiac manifestations, heart failure, valvular disease, requiring a pacemaker, shortness of breath, fatigue, leg swelling. When we talk about the variants, the most common in the United States is actually V122I. And this is important because it is reported to be in 4% of self-identified U.S. Black population. So that's 1 out of every 25 can have this mutation, which then can lead to disease. So this is a table showing some common variants or mutations. I wanted to go over the most common in the United States, and that would be these first three, which you see here. These represent more than 70% of the variants in the United States. So we have the V122I that we said, very common in, it's most common in the United States, but seen in 4% of African Americans. It's from people that have Caribbean and West African descent. And we see more of a cardiac manifestation, so that those heart failure symptoms can be present in this particular patient, but also some of the neurologic symptoms as well. And then V30M, there's an early and a late onset. So early onset, you can see it less than 40 years old. And the late onset, you can see it greater than 50 years old. And you can see this in Portuguese, Japanese, and Swedish descent. And this particular early V30M has a more neurologic phenotype. And the late onset, you can see more of a mixed phenotype. And then lastly, T60A, we see this in the Irish descent. It can be greater than 50 years old, and you see kind of a mixed phenotype where you have cardiac manifestations and neurologic manifestations. Again, these three represent more than 70% of the variants that you can find in the United States. So in order to determine if somebody has hereditary ATTR versus wild-type ATTR, it's very important to get genetic testing. That's how we are able to distinguish the inherited form from the acquired form. The acquired form usually happens as you age, usually between the 7th and 10th decade. But you can still commonly find and diagnose patients with hereditary around that same age group as well. So when you do genetic testing, you can find the specific gene. Talked about there's over 150 genetic variants. And then when you find that specific gene that runs in families, you want to do cascade testing within the family so that you can identify other family members that carry that genetic variant. And then hopefully you can prevent them, or you can find out if they're at risk for getting the disease. So thank you all for joining. This has been a brief overview of hATTR. If you need further information, please reach out to the ARC organization.